Welcome to the MDT Tips and Techniques video. You will note that the MDT looks and feels different, but the processes remain the same. Now this video aims to cover the use of the MDT and also look at some additional features. Universal features. The new mobile data terminal requires the user to log on prior to use. However, some features such as the duress, sat-nav, and the reversing camera are available at all times. Logging on. Logging on to the MDT requires the completion of all mandatory fields on the log-on screen. The mandatory fields are mode, crew skill, and the Officer 1 ID number. Note that on this screen, the verify and log on buttons are currently disabled because the mandatory fields are blank. To commence the log on process, touch the mode field and select either acute or transport mode. Verify and log on are still disabled as there are still two mandatory fields that do not contain information. Touch the crew skill field and then select the appropriate skill level for the crew. The crew skill levels are automatically filtered based on the selected mode. Now select the Officer 1 ID field and enter a relevant Officer ID number using the keypad. Once all the mandatory fields have been filled with information, the Verify button will become active and appear blue. The user can then choose to enter more Officer ID numbers or verify the current officer information. Press the Verify button and wait for the MDT to validate the information and return the correct officer names. Now, once the information has been successfully verified, the message Verification Passed will appear at the top of the screen, and the Log On button will appear blue. You can then select Log On to complete the process and be taken to the home screen. New incidents. When a new incident is delivered to the MDT, the screen will flash red, and the MDT will announce an audible alert. Now these alerts will continue until the new case is acknowledged. A new incident on the MDT will feature New Acute Incident or New PTS Incident at the top of the work area, and the Incident or Unit Status field will display DISP. Acknowledge the incident by touching the screen. Note that as a safety feature, acknowledging the incident within 1 second will only stop the audible alert and may require a second touch to stop the visual alert. Once acknowledged in this way, the status of the MDT will update to ACK. Expand information. The information fields on most screens can be expanded to view cut-off information. If required, touch an information field and it will expand to a full screen. You can return from full screen view by touching the screen again. Caution notes. When receiving an incident with a caution note, the caution button on the incident screen will flash yellow. To open and view the caution note information, press the caution button. The caution note information will be displayed in full on the screen. Return to the Incident Details screen by selecting Close on the Caution Note screen. The Caution button will no longer flash after opening the note and will appear orange in colour, signifying that the Caution Note has been viewed. When there is no Caution Note on an incident, this button will appear grey and disabled. Automatic routing. The MDT includes a new feature which will allow the user to route to an incident address automatically. Pressing the Route to Incident button on the Incident Details screen will open the sat-nav screen and immediately commence routing to the incident address. The incident address is displayed on the left side of the screen. When responding to an incident, the user must also select On Case at the bottom of the page to update the status to Responding. The user is able to return to viewing the Incident Details screen either by opening the menu and selecting Home or by touching the title bar at the top of the screen. The voice navigation component of the satellite navigation will continue while viewing the incident details. The user can at any time view the sat-nav screen again by pressing the globe icon located at the top of the screen. Once on scene, the sat-nav will stop routing, or the user can cancel routing by pressing the cancel button on the left of the sat-nav screen, and then update the incident status to on scene by pressing the on scene button at the bottom of the screen. Departing to destination with automatic routing. To update the status of an acute incident to departing, the user must select DEP or DEP1 from the bottom of the screen. Now, if the crew is transporting code 1 to hospital, the user must select DEP1. When DEP or DEP1 is selected, the departing to destination screen opens and requires entry of destination information. The number of patients field defaults to 1, but can be changed using the keypad. The user must select a destination by touching the destination field and selecting a hospital from the list displayed. Once all information has been entered, the MDT user has 2 options to choose from. Pressing OK means that the user does not require satellite navigation, and this option returns the user to the incident details screen. Pressing Route to Destination will open the sat-nav screen and commence automatic routing to the destination selected. Now note that the destination address is displayed on the left of the screen. Both these options update the incident status to departing in VisiCAD. Now this process is different for a patient transport incident, which will be explained later in the video. Once the crew reaches their destination, the sat-nav should cease giving directions, but if required, the user can select Cancel to stop the routing. Then press the DEST button to update the incident status to at destination. The incident times will be displayed on the screen. Complete the case by updating the status to partially available, and then request to clear. Radio the dispatcher and request to clear as per normal procedure. When the dispatcher completes the case, the MDT will display a case complete message. Viewing times on a completed incident. To view times on a completed incident, start by opening the menu and selecting Completed. This will display a list of completed incidents on the screen, and then touch the correct case in the list to highlight it on the screen. Highlighted incident details can be viewed by pressing the Details button on the right-hand side of the screen. Now you will notice that a completed incident appears visually distinct with a blue background. Once the completed incident details screen opens, open the incident times by pressing the Times button on the bottom left of the screen. Station assignment and automatic routing. When a crew is assigned to stand by at a station other than their home station, a station assignment alert is sent to the MDT. When the station assignment alert is delivered to the MDT, the screen will flash red, an audible alert tone will start, and the unit status will update to reflect to station. Touching the screen after a few seconds will acknowledge the assignment and stops the alerts. This screen features information about the assigned station and a Route to button. Pressing the Route to button will open the sat-nav screen and immediately commence routing to the station address. The address to which the sat-nav is routing is displayed on the left side of the screen. Once at the station, the sat-nav should cease giving directions, but if required, update status to at station to cancel routing. Patient transport incident. When a new PTS incident is delivered to the MDT, the screen will flash red and sound an audible alert tone until the new PTS case is acknowledged. The MDT will display New PTS Incident at the top of the work area, and the incident or unit status field will display DISP. Touching the screen after a few seconds will acknowledge the incident, stops the alerts, and update the status on the MDT to ACK. The user should then update the status to responding by pressing the En route button on the status button tray at the bottom of the screen. To commence automatic routing to the incident pickup address, the user should press the Route PU button. Now this will open the sat-nav screen and immediately commence routing to the pickup address of the PTS incident. The routing address is displayed on the left side of the screen. Once on scene, the sat-nav should cease giving directions, but if required, press the Cancel button on the sat-nav screen to stop the routing, and then press the At Scene button to update to At Scene. By opening the menu and selecting Home, the user can view the incident details. Once the patient has been picked up and is ready for transport, the MDT user should press Trans from the status button tray and update the status to Transporting. If routing to the destination is required, the user can press the Route Dest button on the incident details screen to open the sat-nav screen and immediately commence automatic routing. The destination address is displayed on the left side of the screen. Once at the destination, the sat-nav should cease giving directions, but if required, press the Cancel button on the sat-nav screen to cancel the routing. Then press the At Dest button to update the status to At Destination. At this point, the incident times will be displayed on the screen. In order to complete the case, the MDT user should press the P/avail button to update the status to partially available and radio the dispatcher. When the dispatcher completes the case, the MDT will display a Case Complete message. Activating and deactivating duress. Duress cannot accidentally be activated or deactivated on the new MDT. To activate duress, press and hold the duress button at the top left of the screen for 2 seconds. When the left half of the duress icon appears red, this means the duress has been sent to VisiCAD. When the right half of the duress icon also appears red, this means that VisiCAD has received the duress activation. When the duress button is pressed, all other functions on the MDT, except for the reversing camera, are unavailable for use. To deactivate duress, press and hold the red circle for 2 seconds. The duress icon will change back to a single red circle to indicate that the duress is now deactivated. Day, night, and blank screen mode. The MDT can be switched between day and night modes, as well as a blank screen for privacy. To switch between day and night modes, touch the day and night mode toggle on the top of the screen. The user is also able to blank the MDT screen for privacy and night driving purposes. This can be achieved by holding the day and night mode toggle for a few seconds. The screen will appear black except for the duress icon, which remains accessible at all times. The blank screen can be restored by touching the screen, and a blank screen will automatically restore if an incident is received on the MDT. GPS information for aeromedical. GPS information can be displayed by holding down the globe icon at the top of the screen. GPS information for aeromedical response and VisiCAD geolocation can be found here. Communication issue diagnosis. The 2 green arrows on the title bar of the screen indicate a network connection between VisiCAD and the MDT. Now, a loss of communication between the MDT and VisiCAD is indicated by 2 red exclamation marks. To view further information regarding communication status, touch the 2 arrow icon. Calibration. If the MDT user is having difficulty using the touch screen or the screen appears unresponsive, the screen may need to be calibrated. Calibrating the MDT touchscreen can be achieved by opening the menu and selecting Configuration. The user should then select Calibrate and follow the instructions. In order to calibrate the screen, a series of crosses will appear on the screen, and the user is asked to touch and hold each point. This exercise is most accurately completed using a stylus or pen point. Thank you for watching the MDT tips and techniques video.